I'm Congressman Randy Forbes, and this is the health care bill that you've heard so much about. It's interesting, it's just under 2,000 pages, and we're told that they actually had to fight to get it under 2,000 pages. You know, years ago when I began law practice, in fact, I don't think I'd been practicing but about a month, I had a client that came in and they slipped me a single sheet of paper. And on that sheet of paper it said simply this, it said, do everything we talked about and remember, money is no object. I was so excited I went down the hall and carried it into the managing partner's office, and I told him what the client had said, showed him the slip of paper, and he smiled at me and he said, Randy, the reason money is no object is because he doesn't intend to pay for it. He uses his father's money because he doesn't have any money. And then he rolled back in his chair, pulled his drawer open, and took out another sheet of paper that said this. It was from his father, and it said, I'm tired of this reckless spending. Please be on notice that he's hereby cut off. Enough is enough. And you know, if you don't read anything else through this bill, one of the things that I hope you'll do is read between the lines, because between the lines it very clearly says this, money is no object. And the reason money is no object is because the proponents of this bill are not spending their money, they're spending your money. They're spending the money of our senior citizens that they take from Medicare. They're spending the money of our business people and our workers when they kill jobs from this bill. And they're spending the money of our grandchildren because they're saddling them with a debt that they will not be able to pay back for decades to come. Just a couple of facts that I'd like to give you in your analysis of this piece of legislation. First one is that it will be 5.5 million jobs that are lost because of this particular piece of legislation, according to all of the studies that have been made about it. $729.5 billion is the amount of taxes that will be placed on small businesses and individuals who cannot afford health care coverage. $1.055 trillion is the amount of new federal spending that will be covered in this piece of legislation. $88,200 will now be the definition for a low-income family to qualify for purposes of this health insurance bill. That's about 6 or 7 times my starting salary when I came out of law school, and that's for a low-income family. 114 million, that's the number of individuals who are suggested could lose their current health care coverage if this bill becomes law. 43 is the number of entitlement programs this bill will create. 111 is the number of additional offices, bureaus, commissions, and programs and bureaucracies this bill creates. 3,425 is the number of times the word shall is used to dictate what we should do from this bill. $60 billion, that's the amount of loss every year that's taking place in Medicare alone due to fraud, and this bill does absolutely nothing to curb it. Now, I want to also bring to your attention the fact that on November the 5th, 2009, at noon on the steps of the United States Capitol, there will be a press conference by a number of people, members of Congress and individuals from across the country, who will be basically saying in a nutshell, we're cutting off your spending. Enough is enough. We're tired of this reckless spending. I want to just point that out to you and invite you to attend. We will have people from all over the country. Unlike the reading of this bill that took place where the public wasn't allowed to attend, at this press conference, the public is more than invited to attend. So we look forward to seeing you on November 5th, 2009. Thank you very much.